Many people think when they get a genetic test, it's going to tell them everything they want to know. When really we get back inconclusive or negative results that just add more confusion or unanswered questions. I always say a genetic test is only informative if something comes back positive, meaning we found something wrong in a gene that explains that the gene isn't working and that could be the underlying cause of the disease in the family. That happens about 25% of the time in familial pulmonary fibrosis, and it happens about 5% or less in sporadic cases. So what about the other 75–80% in familial, and what about the other 95 to 99% in sporadic? Well, what it means is we still have a long way to go in learning other genes that could be interacting or playing a role. When we do genetic testing, we can actually get back 3 results. Positive, which happens a lesser amount of time, negative, which is most of the time, and there's something in between. It's usually referred to as a variant of uncertain significance. And basically what that means is it's a change in the gene that's different from what we think is normal, but it could be something just unique to that person or to that family. Just because we're looking in that gene and we find an abnormality, we all have little changes in our DNA. That's why we don't look like each other and we're not clones of each other. So we can't jump ahead and jump to conclusions that, oh, this is what is causing it. There are rules when to call a change in their DNA positive and harmful, and there are rules when to say negative and benign. When the laboratory can't determine based on their set rules, they'll call it in the middle. It's inconclusive. And a negative result doesn't rule out an inherited form of a disease like pulmonary fibrosis. It just rules out the genes that we actually tested for.